name is Selena. I'm the pharmacist at Mercy Hospice. I'm here to talk to you about pain management. As you know, this is part of the Manaaki program. So what is pain? The medical definition for pain is an unpleasant sensation that can range from mild discomfort to agony. So pain is a very individual experience influenced by our own perception, history, expression of pain. So our ability to cope, our mental well-being, and also our previous experience of pain. Sometimes it's also related to our family or cultural background. So as you know, that pain has both physical and emotional components. The physical part of pain results from nerve stimulation, and pain can accompany cancer and other progressive disease, and it can affect our lives, physical, emotional, and spiritual being. So I just want to talk briefly about types and levels of pain. This is important because sometimes you need to describe to the doctors, and also just from what they usually say to you, it's good to have an understanding of the language that we use. The types of pain can be divided into 4 different types: the somatic pain, visceral pain, neuropathic pain, and bone pain. So somatic pain is this aching, throbbing, and localized pain. It's more of something perhaps you can see outside physically, but visceral pain, in the contrast, is more a dull pressure pain. It's usually more of a we call smooth muscle pain, or things that happens inside your body. The neuropathic pain is a burning, shooting, and sometimes pins and needle and tingling pain. And the bone can be constant and deep. The levels of pain that we usually describe are acute, chronic, or breakthrough. The acute pain can be mild to a severe, but it usually comes on really quickly and lasts only short time. Chronic pain is sometimes the pain stays for a long time, comes back often, or just won't go away. The breakthrough pain itself is intense rise in pain occurring suddenly, and sometimes it's because with activity, and sometimes it just happens when you move or when you just change position, and it can happen several times of a day. So what I would like you to tell your doctors are these are the key questions I have put on the slide. How severe is the pain, and what does it feel like? Sometimes people use a verbal descriptor like, oh, it's just mild pain, moderate, or you can say it's excruciating. Sometimes you can give a number. We usually ask you between 1 to 10, if 10 is more severe, what's the level of pain that you are experiencing? Sometimes we use the visual tool, such as the face pain scale, as you can see here. It gives an indication. It also helps with people that English is not their first language. It just helps them to tell the physicians or the clinicians the level of pain that they have. Also, I want you to tell the doctors, where does the pain occur, how often is it occurring, and is it radiating to other parts of your body? And when did the pain start? What helps with the pain, and what makes the pain worse? So there are quite a lot of different myths about pain. Some people worry about taking medicines because they may have really awful side effects. Some people worry that they will get addicted to the medicine, and then they worry that if they start using the strong pain relief too soon, it may not be effective later. And sometimes people also have this idea about taking strong pain relief may shorten their lives. There is a really good website, which I have got the link down here. It's poiproject.co.nz, and then in it there is a patient information leaflet on morphine and opiate medicines. It talks about all these myths that we have about pain. A lot of times it's more like misunderstanding or not really understanding what the medication could do to you. So I'm here to talk to you a little bit more about medicines used for pain. So in general, the pain management principle is that we want to treat the underlying cause of pain where possible. If there is an infection, we want to treat the infection, and we also want to reduce the pain ultimately, as well as minimize any adverse effects or any side effects that's related to the medicines they use. Ultimately, we want to allow the functions to be maintained. So pharmacologically, we use painkiller. But non-pharmacological intervention should also be considered because they do offer a lot of help in this instance. Fundamentally, the regular assessment of pain will improve the management and outcome. My next slide is a WHO analgesic pain ladder. As you can see that we usually start with step 1, paracetamol and some ibuprofen or diclofenac, which you may have received from over the counter. They are to help with any inflammation. Later on, we will add a weak opiate such as codeine for mild to moderate pain, and then we will change on to a strong opiate. And so it's important that you have a bit of confidence at the resources that you're getting in terms of coping with pain. The response to analgesia is very variable amongst individuals. You may start with paracetamol, but you may start going on the stronger opiates depending on the history of medicines that you've had before. The non-pharmacological treatment here, it really depends on the cause for the pain. So physical interventions such as exercise, physiotherapy, and massage can be appropriate alongside the pharmacological regimen that we discussed before. Sometimes psychological distraction techniques such as listening to music, reading, meditation can also be very helpful here. So, in summary, that good pain control requires a really good communication between patients, carers, medical and nursing staff. And that's why it's really important to report the type of the pain you have, the level of pain you have, where does it go, and all the things that I mentioned before. And the most important thing for you to know is that the earlier the pain is treated, the more effective it is, so that we can get on top of the pain and just try to be open and share what is happening regarding your pain, perhaps keeping a pain or symptom diary, and then just making sure that you have a really good support network around you, someone who can support you. Always ask your pharmacist if you're not sure about medicines, or check with your doctors if there are anything that you're concerned about, and consider that non-pharmacological method to enhance your quality of life. I hope you find this really small presentation useful. If there's any questions that you have, please feel free to contact any of your clinicians and to get in touch with us. Anything to do with medicines, talk to your pharmacist. I'm sure that they can give you really good advice. Thank you. Bye bye.